Hi, my name is Natalie, and I'm an occupational therapist and a pelvic floor therapist. I've been getting a lot of questions lately about when you should go see a pelvic floor therapist, as far as like what symptoms you might be experiencing, how that's impacting your life, and when you should decide to reach out to see this particular specialist in this area of care. Today, let's talk about hysterectomies. So, did you know that you can have pelvic floor therapy before your hysterectomy and after your hysterectomy? And that goes for any type of hysterectomy, because there's a lot of different kinds where they sometimes take everything, sometimes they preserve ovaries, different things. There's a couple of reasons why pelvic floor therapy can be helpful in this case. One, there's probably a pretty good reason why you're getting a hysterectomy. Usually there are a lot of symptoms leading up to that, and that is a solution that you and your doctor have come to decide on. A lot of times there's pain, there's inflammation, maybe there's other symptoms like you're having bladder issues, bowel issues, bleeding, all kinds of things leading up to it. So the pelvic floor therapy can help with those symptoms. Also, a hysterectomy involves removing an organ. So when you're done with a hysterectomy, your body has to figure out kind of where to realign everything. There's going to be an extra space in your abdomen, and your body has to sort of figure out like what to do with that space. So that's another reason for pelvic floor therapy. Plus, even though sometimes it can be relatively less invasive depending on the approach they take, it's still a surgery, there's still scars, and scarring can affect a lot of different things. It can affect your positioning and just your comfort level, so we can also help with that. I actually love a sort of a prehab approach if you're able to take that. So if you can see a pelvic floor therapist before your hysterectomy, even if it's just a couple weeks before, that would be awesome, because we can go over strategies for connecting with your core and your pelvic floor, getting things to sort of work in symphony together and be coordinated more, because a lot of us just aren't connected to our bodies very well, especially women. We're just not taught that. So we can teach you strategies to get connected and to sort of prepare your body before the major surgery. And then after you have the surgery, after a little bit of time, giving you some healing time, we can revisit things and see how things are going after the surgery. With a background in OT, I also love to focus on functional things. So if we can get your body doing really good habits before the surgery, then afterward, it's kind of muscle memory. So teaching you ways of getting in and out of the bed, standing up from sitting, navigating your house and your community and all kinds of things like that. If we can practice really good habits beforehand, then when you have the surgery, you kind of jump back into those habits a little bit more naturally, and that helps with the healing process. It helps with all kinds of things. Of course, this is just touching on why you might want to have pelvic floor therapy before and or after a hysterectomy. Of course, you can talk it over with your healthcare provider. Sometimes it's helpful if you can get a script for pelvic floor therapy beforehand. Sometimes you don't have to, depending on your state where you live, but you can always reach out to the pelvic floor therapist in your area first, and they can kind of help guide the next steps, because sometimes navigating the healthcare system can be a little bit confusing. Remember that pelvic floor therapy can be with an OT or a PT, occupational or physical therapist. Either way, it's postgraduate specialized training that we get. So it can be either type of therapist. If you just ask for pelvic floor therapy, that actually helps, because then it doesn't have to be like if you ask for a PT, then you can't necessarily see an OT if that's what's on your script. Post questions, because that was just a little tidbit and I want to hear what you have to say.